I think people might sort of stream in as we go, but let's get started. Thank you all for coming at the end of a very long but exciting day. It's great that you came, especially considering we have such a sexy title. Made it as beautiful as we possibly could, Engaging Patients in Practice-Based Research Programs. So two acronyms we're going to talk about today, the BC-POPRC and the PERC. And Christy and I are going to go through a little bit of an explanation on that. First of all, is anyone here a care provider? One care provider here. Okay, great. Well, I think that all care providers feel that they would like to know that whatever care they're providing is the best that they can do. And that's kind of the premise that we're setting today for practice-based research. So let's go through this. I think what I'll do is talk a little bit about what we're talking about today, set the stage for it, and then introduce our panelists as we go. So I'll start off by introducing myself. I'm Larry Mraz. I'm the practice-based research lead at the patient-oriented research services lead. I don't even know what my title is right now, at the BC Support Unit. And I'm very privileged to work with a number of people in various organizations, and they're represented here today. So I'm going to start off by inviting Christy to come up because we are going to do a short presentation on what the collaborative is, what practice-based research is, and why we're here talking about this.
And hello, everybody. I'm Christy Coldwell. I'm one of the patient partners that's part of our PERC. I have lots of extensive lived experience with our healthcare system, and yeah, I'm really excited to be with you all today.
Okay, great. So what is practice-based research, and what is the research challenge that we're talking about today? So the BC Support Unit got together with a group of organizational representatives from 5 different organizations in Vancouver, and they're listed below. BC Cancer, Providence, BC Mental Health and Substance Use Services, BC Children's Hospital and Women's Hospitals, and Vancouver Coastal Health Research Institute. And together we formed this group that decided to come together to talk about how they support practice-based research in their organizations, and particularly how they support competitions to fund small practice-based research projects. And then we also have an associated group that we formed called the PERC. And the PERC, the Patient Engagement Research Collaboration, is a group of family and patient partners, people with lived experience who got together to help guide this work. Here's just so you know who's who, the group and the panel. We'll get them to introduce themselves as we go. So first of all, what is practice-based research? Practice-based research is research that's done and by clinicians. It's addressing questions that are relevant to care. In other words, these are questions that are developed by practitioners, by healthcare providers, as they deliver their healthcare, as they provide care. Questions arise. And this is a perfect place for providers to answer those questions by doing research that would actually address their specific concerns in their specific settings. So these programs were developed in each organization to fund these sort of projects. And they're run as competitions, they're awards, but the purpose of the awards is to build research capacity in the local clinical setting rather than to produce research findings. But both happen in these projects. So why did we get together, and what does it mean? When we got the organizational representatives from these 5 different organizations to get together, we decided that it was a great opportunity to sort of think about how we operate these practice-based research challenges, what sort of curriculum we'd use in training. We can do surveys to follow up on researchers and patients as they work together. And of course, it's all about building capacity to do this work amongst the organizations. This is, from my understanding, this is the first time that a group of health authorities and organizations in BC have gotten together to collaborate in this way. So it's really important to note that patient engagement was built into all of this. This was the premise for us starting to do this work. And I think Christy is going to take it from here, thankfully. Here we go.
Indeed I am, Larry. Thank you. So I think it's really important to highlight that part of this work is really ensuring a coordinated and a collaborative way of really integrating meaningful engagement across the research programs. And so to that end, they've ensured that patient family partners or others with relevant lived experience are part of advisory committees, that they serve as reviewers where funding decisions are made, and some of the programs actually require engagement as a stipulation of funding. And these are just some of the examples. We're going to delve a little more into this during our panel discussion. And here you can see a really high-level overview of our PERC, of our composition. And really what our group is it's composed of really dynamic individuals that have really diverse lived experiences with our healthcare system. So both as caregivers, as patients, or as combination of the two. And we have representation from all the participating organizations and health authorities, and that's involved in this work. And that was really important to ensure that we had a wide assortment of experiences that could really offer an enriched understanding of engagement. And you will see here that our main goal is to really bring about and support and encourage and build capacity for patient-oriented research in these practice-based programs. And if you haven't already guessed it, it's really, together we don't exist in isolation. We really are interconnected. And we can't exist without the other. Our PERC, or the larger BC-POPRC as the acronym goes, we really depend on one another to be successful in achieving our goals and our visions. And that's what you're going to hear more about related to this work during our question and answers and during our discussion today. And then this, Larry, are you taking over this one? And this is just to thank everyone who's been involved in this work.
Absolutely. Just a reminder that there's a lot of people that are involved with this, and we're very grateful for everyone's help. Okay, so what I'd like to do now is to get the panelists to introduce themselves. Ryan, why don't you start and then pass the mic down?
Hi everyone, my name is Ryan Fairbrother, and I'm the Patient Partnerships Coordinator at the BC Support Unit, and I get the lovely privilege of working with this panel every single month.
Hi, I'm Christine Wallsworth, and I'm a patient family partner. I've been with Patient Voices Network and KEEN, which is a Community Engagement Advisory Network, for the past 11 years. And I'll pass it down.
Okay. I'm Aggie Black. I work at Providence Healthcare as Director of Research and Knowledge Translation. And I would say probably for the past 12 years, I've been coordinating practice-based research, and almost since the very beginning, I've been involving patients and people with lived experience in how to make that research more relevant.
Hi, everyone. Thanks for inviting us here today to share our work. My name's Amanda Chisholm. I'm with Vancouver Coastal Health Research Institute. Aggie's kind of like my counterpartner, so I organize our Research Challenge and KT Challenge programs as Senior Manager of Education and Funding. And yeah, I'd just like to echo that it's really important to engage the patient and family partners in our work and to guide us along the way.
It just sort of occurred to me, I didn't mean to claim that somehow we invented practice-based research or started it here. This has been running for a long time, and I just wanted to recognize that. So I'd like to ask Aggie and Amanda, why do you support practice-based research in your organizations? And either of you may go first.
I'll go first, but I'm going to say it started with my predecessor collaborating with Aggie. Back in 2014, 2013, right? Recognizing that our frontline healthcare providers are in a really unique position to identify the challenges in delivering care and coming up with solutions and developing new ways to deliver care that can improve health outcomes for our patients. So it's really that unique perspective of their position where they are, and just empowering them to be able and training them to be able to do, their work.
I would echo all of that and just add to it that for those of you who heard Harlan a little while ago talking about a researcher who, reflecting on his career, didn't feel that his research had actually impacted patient care. And I would say the opposite is true for practice-based research. In my 12 years of experience of this, if the impacts of it begin with the impact on the researcher themselves, who is usually a direct care nurse or a direct care social worker or a physio or occupational therapist, social worker, dietitian. So they're impacted by this engagement because maybe for the first time they're working with people with lived experience in setting research priorities and conducting research projects. They also, when there are positive findings from these projects, much more readily able to implement those into care for the benefit of the patients that they're serving. So I believe the impacts are multiple, both on patient care and the healthcare system and also on the researchers themselves.
Oh, that's great. Thank you. So tell me, Aggie, we started the POPRC, that beautiful acronym, back just around the same time that COVID started. We brought together these 5 different organizations. So tell me, how has this organization, this collaboration, helped you in your work, if it has?
Well, it definitely has. I mean, it means that once a month we get together with people from other organizations who are also leading practice-based research, so we can share ideas about how we're overcoming stumbling blocks, how we're building support for the programs, how we're sharing findings from the program. Amanda and I have just recently collaborated on trying to get more exposure for results from some of our practice-based researchers, opportunities for them to share their findings. One of the things that this collaboration has really done for me is bring me closer to the work of Christy and the PERC, which helps me identify patient partners who are particularly interested in partnering on research. And that's been just phenomenal when we've had people, because for years I relied on Christine, who is marvelous. And I feel like we almost wore her out because I would ask her to collaborate on the advisory committee, and then can you help with reviewing proposals, and would you also partner with these teams? So with PERC, we still partner with Christine and extremely much value that partnership, but we're able to also invite in some other patient partners who've already worked with Christy and identify that they're interested in partnering on research. So yeah, the collaboration for me has meant I get a network that helps me do what I want, do my work even better.
And I think at Vancouver Coastal Health, I started working with Christy, and we did some training for patient partner research just before the pandemic started. And it was really with the formation of the PERC and bringing the POPRC together that we're giving them an avenue to exercise the skills that we're training them with, right? Providing those opportunities to partner with our clinician teams, and then also being reviewers on the projects and helping us guide our programs. So really that connection has enabled it, and we're hoping to continue to build capacity and expand the training a bit more.
Great, thank you. So I have another question now this time for Christy. You can hold on to that mic. Got enough mics. Christy, tell me a little bit about how has it been like for you to be on the PERC?
I would say that being involved in the PERC and the group, it's been a really rewarding experience, because here I am being able to be surrounded by like-minded individuals who all share a passion for meaningful engagement in the world of research. And the other thing that I found really advantageous is that these are individuals who, again, have that diverse experiences. They're unique to the various programs or the organizations that are involved. And so it's really allowed me to enrich my understanding of what engagement can look like and how you may want to consider that when it comes to research programming and various activities. So it's been a really positive experience that's enabled me to grow, but it's been a mutually sort of win-win with the organizations and all of the patient partners. And sorry, I know I use the term patient, and that's just how I often refer to individuals with lived experience. So by all means, I know that's not an all-encompassing term, but I just wanted to note that.
Great. I'm going to pass that to Christine. Excuse me. Christine.
Yes. Sorry, yes. I just want to reiterate that. For me, being a part of PERC was actually, we saw the organization grow. I remember when I started being a patient and family partner on the practice-based research challenge with Aggie. Of course, I was the only patient partner at that time. So to see the amount of patient partners now that are actually involved in research, and it's in part thanks actually to all of these collaborations, is actually very, very rewarding. And I want to congratulate, first of all, Providence. I mean, they took the first bold step to actually invite a patient partner onto your research, practice-based research challenge. So, and I think that actually changes the lens of research as a whole. It changes it it switches the view from research participants to research partners.
Well, that's great, thank you. So Christy, can you tell me a little bit about some of the work you've done in practice-based research?
Of course I can, Larry. So it's been really, really diverse. And I think, it was interesting. It's evolved as well as our partnership has continued to grow. It started off really getting kind of a lay of the land, understanding where everyone was at. And then from there, it's been more of, like, as I mentioned previously, more of a coordinated effort and ensuring more of a standardization across the organizations, which as someone who's been involved in different ways in different organizations, I really welcome that. And I think other patient partners have as well. And so that's related to things like serving as a reviewer, where we're reviewing these applications for funding, looking at them through sort of that patient-oriented research lens, areas that could be strengthened or enhanced. We've also really had the opportunity, as the organizations have grown and learned more about patient engagement and what it can look like and the various opportunities, they've brought us in. They brought our PERC members in, our group in, for a lot of different sort of consultations and our insight and our feedback, and they really want us involved in every stage, whether they're developing sort of like an add-on to the programs, or whether they're considering a new policy around the research, or if they're looking to develop some sort of an education tool. They've really worked with us on that. And so it's been really dynamic, the types of activities. And I mean, that's just a couple. I don't want to hog the mic with that because I definitely could go on and on. But yeah, so it's really been a whole array of different activities.
Oh, that's great. And Christine, is there any particular sort of practice-based research event or activity that particularly jumps out to you?
Okay. Unlike Christy, I actually have to have notes. My memory is not so good as it used to be. But anyway, as I mentioned, we have actually brought more agencies into the collaborative, which is great. And for example, the BC Cancer Agency joined in 2021. At that time, I think we also provided informal Zoom workshops and breakout sessions for new research clinicians to help them become more knowledgeable and confident within themselves to find research partners. The PERC group also helped put together a reviewer manual, which will assist new PFPs, reviewers, to better understand what it means to be a reviewer and what the commitments look like, because I think a lot of people actually don't know from the get-go how much time is actually involved in research. Most people think of research as being like 6 months. No, you take it from year to year, So it's good to give people a realistic view of exactly what research is, and I think that's it.
Great, thank you. Let's go over to Aggie and Amanda again. So tell us a little bit about sort of how patients have been involved in your work, and what was your experience like with that?
So I would say initially we had Christine on the Research Challenge Advisory Committee. So she was advising us as we developed the program, and she taught or sometimes spoke to the teams in the workshops. But I had a kind of aha moment when Christy and I were leaving a meeting together where we talked about patient-family partners and whether they could review proposals. And we got a little bit of pushback from one person at the meeting. I don't even remember that person's name. But Christy and I kind of stood in the hallway and talked, and we said, well, what if each proposal had scientific reviewers, but then we had a patient-family partner who reviewed it from their perspective, so they don't have to make sure the literature review is up to date or the methodology is perfect. They're just looking at it to say, were patients and family members, people with lived experience, meaningfully engaged in this project proposal? And because of that conversation, we kind of developed the training that Amanda was referring to, that Christy and Christine have both helped with, where patient-family partners who are interested in reviewing research proposals actually take on that task. So all the proposals at Providence, and I think at other health authorities now, receive at least 2 scientific reviews and 1 review by a patient-family partner. So that's been incredibly helpful, because sometimes I'll take verbatim the notes that the patient-family partner reviewer puts in their review and send it to these new researchers, because sometimes what the person has said is, this project is so important, we need somebody to look at exactly this. And so they may have also constructive comments, but it's so rewarding to tell a new researcher that patients have validated the importance of your project idea. They also have some suggestions for how you might share your findings at the end. So we've definitely are fully embarked on having patient-family partner reviewers look over the proposals. And then we've worked really, really hard to have every single team have a patient-family partner or more than one as partners on their project. It's not always easy to find a patient-family partner interested in some of these topics, because some are quite niche. But we've usually found a way to have patient-family partners engaged, at least consulting at some level at some stage in the research. And some of them are involved right from the beginning, from the initiation of the idea, all the way through to funding, all the way through to conducting the project and presenting at conferences on the findings. So it's been incredibly rewarding. And one of the main things for me is that it validates that these projects are important to the person we're all here to serve, which is patients and families.
I think I'll just add on to what Aggie was saying there, because we have very similar processes between our 2 programs. But it links back to one of the earlier conversations when we were talking about building capacity and, as a funder, do we make it a requirement? And we can't really make it a requirement till we have the training and supports available to the teams to do this work, and to the patient and family partners to be engaged in that work. And I think that's where the PERC comes in. Right, so we need to move forward with, as an organization, supporting that initiative where, to make projects really successful, we need to have the voice of the patient-family partner in it. And so with that, we need the PERC to help with, make sure we got the training and the resources available to move that work forward.
Well, that's great, Amanda. So you're saying the PERC has helped you in some ways here in developing some of these training, for example. Can you give us some other examples of how the PERC has helped your work?
I guess circling back to having a conversation about having, patient and family partner reviewers on our committees. In doing that, we did a survey to see how was their experience in their first year, and that work was led a lot by Larry and Christy. And then we took the results from those interviews back, and then looked at the recommendations from the patient and family partners. And we moved forward with a project to create a training manual to help new reviewers get started, and what are the resources and supports that they need along the way. And we had patient and family partners from the PERC involved in developing that manual.
And how about you, Aggie? Is there anything that jumps out as work with the PERC?
Well, I would say one thing that the PERC learned when they went and talked to all the patient-family partner reviewers was that we, as coordinators of these initiatives, were not always going back to them to tell them which projects were funded. And so they were, and I've heard that many times from patient-family partners, completing the loop, I think is what somebody called it. Like, if you're going to involve us, let us know what happens with these projects. When they're finished, let us know what you learned and what how that's going to improve patient care. And for the reviews, it was let us know which projects get funded, because it's easy for us to get really busy, and we send out the announcement to the St. Paul's Foundation, we send it to PHC News, but we don't forget to send the announcement to the people who helped us do the reviews. So I think closing the loop, I think, is one thing we really learned from PERC members. But mostly it's having people like Christy and Christine who will talk to other patient-family partners to say, if you're interested in this, I can tell you how it was for me, and I can tell you there's support available. And it makes it, not, I think, I would imagine, not so intimidating for new reviewers, for new patient-family partners, because these two are kind of there to be mentors and tell them what it was like and tell them that our researchers are new. They're your nurses and your social workers. They're not scary. They don't know that much more about research than you do in some cases. They're just brave enough to try to tackle this, and they want your help. So PERC has really helped me with recruitment of patient-family partners, but also with sort of reminding us how to keep doing it better.
That's great. Amanda, anything else to add to that? No?
I don't think so. I think
Okay.
Aggie wrapped it up nicely.
All right, let's ask Christine and Christy, how are we collaborating so far? How are we doing and what can we do better? Double-ended question there.
No, go ahead.
We won't fight over it now. You know, Larry, I'm going to get to that piece, but what I heard from Aggie and Amanda also really brought something forward for me, and I think it's really important. We can't underscore this enough, that yes, we're talking about the advantages of the PERC, the contributions of the PERC, and this collaborative work, but I think we really need to underscore the fact that, in a sense, research can exist often in a bit of a silo, and so we don't always see those wide-ranging impacts. And I think that thing that I've seen, and that also gives me hope through this work, is that through this work, we're actually having more positive impacts, I'd say, on the overall healthcare system. Because as we know, research ultimately down the line is going to help shape and inform the care and the practice that individual users, our patients, our families, our caregivers, whoever it may be, is actually receiving. And this work is fundamentally really grounding those individuals and those lived experience at the center of it. And I think that's a really important piece, that as we go about this work in our daily lives, we don't necessarily consider that and consider those wide-ranging impacts. And that's something that I think is really important to note as well, because it's not always being done, but we need to always sort of bring it back and recognize that.
Great, Christine.
And then I forgot your original question.
No, that's
so
okay.
I'll just
That's
hand it over
fine.
to
That's fine.
Christine.
It was a boring question. You did it.
I think it is important to remember, especially as a PERC member, that our group is actually made up of people with lived experience. And research should actually take note of people with lived experience as being the experts in their particular area. Clinicians can look at it from a clinical point of view, you know, and say, oh, well, if you've got X, Y, Z, then you should do A. But people with lived experience know their own body. And this is what PERC and also the POPRC group brings together. They do recognize that people with lived experience have the capacity to do research.
Do you think that your lived experience, you're able to bring that into the process with this group?
Oh, certainly, yes. The lived experience, like, I come from a family member perspective. It was due to my late husband's Alzheimer's and Lewy body's dementia that I actually became involved in advocating and researching. But he also had numerous comorbidities. But so it's these interactions that give you the knowledge of what works and what doesn't work. And everything doesn't work perfectly for everybody, and you have to understand that. But you have to also reach out and try and make things better.
Okay, great. And so, you know, you were doing this work with Aggie for many years before you joined the PERC. This is a question I hadn't asked you before. But so what's it been like now that you've joined the PERC? How do you feel about that?
Now that I've joined the PERC, I actually feel confident that research is in good hands. We are moving forward. We are getting more people involved. And PERC and POPRC is actually an excellent, excellent base to start building from and to get more people and patients, and not only people and patients, but also researchers, the clinicians. They also have to be involved as well.
Well, that's great. That really leads into the next question that's open for all of you, is why do you think this work is important? I'm assuming you think it's important, but why would you say it is? And maybe I'll go to Aggie and Amanda then. Oh, it's okay, Dick.
Because that's a really hard question.
That's a big question, that's for sure. Because I think the work between the PERC and our organizations is important because it's really guiding the research at our organizations and making sure that it's relevant and that the results are going to be integrated into care and uptaken by the patients and the clients themselves for better health outcomes. So I'll leave it there and let others add.
The only thing I would add to that is one very practical way this has been helpful is helping teams figure out how they're going to do knowledge translation, how they're going to share their findings. So we've had patient-family partners suggest plain language summaries of the findings that might be put in the waiting room of the clinic. So if it's a project on diabetes, maybe you put plain language summary in the waiting room at the diabetes clinic, that you find a way to share findings in the places that patients and their families go in a forum and in a language that's acceptable and understandable, accessible, I should say, to them. Did that answer your question?
Yeah, that's great. So how about Christy and Christine?
So for me, on an individual level, it's important to have patient voices within research so that the research responds to and is relevant to patient needs. Otherwise, why do research? So, but as I mentioned earlier, the people that are most affected by research, which is usually patients, they're usually not at the table sometimes in research. So nothing about me without me. It means that by patients being at the research table, they're able to provide input to help shape the research, which will ultimately improve health outcomes for all patients. So on a system level, it's also to avoid, for me, it's to avoid research waste. Because many times researchers ask the wrong question, or ask the wrong people the wrong question, or just go about it the wrong way. And again, they can also come at it from a different point of view, is you have multiple researchers researching the same question, which to me is a research waste. So I think it's important that we do this work to bring everybody together to be at the same table at the same time to help provide the most beneficial research for everybody.
Well, I don't really have much more to add to that, but honestly, I think, it's like, just makes sense. It really just makes sense to me. And, speaking as a patient and thinking of the world of research, ultimately, we do this and it matters because it's the patients and those individuals whose lives are directly dependent upon it and our quality of life. And so if we're not doing this as a coordinated effort, then what is the point? Why are we just funding research that's just out there? Everyone's doing their own thing. It's willy-nilly. And you're wasting valuable and limited resources in funding dollars. You're producing and you're having outputs that isn't going to have any positive benefit or contribution to our healthcare system. So like Christine says, it's a waste. And no one can really afford that. Our funding agencies can't afford that. The health authorities can't afford that. But most importantly, the patients and the families, they can't afford that. And so I think that's why we do it. And that's why this work is so encouraging to me, because we're finally recognizing that, I think, and we're really taking the steps to see how we can be smart about what it is we're doing and how we can readily bring in these perspectives to, I think, do the best that we can possibly do. We recognize that we owe it to everyone who's involved in this work.
Well, that's great. And, that really is important for us, of course, because that's why we're doing patient-oriented research. Now, with the practice-based research, let's talk a little bit more about that, about how that might relate to things like learning health systems, or what is the value of practice-based research? It's not the same as academic research because it's happening in a clinical setting. So I'm going to throw that question over to the other end of the panel there.
Well, the first thing that comes to mind for me is I think of learning health systems as systems that constantly incorporate data from research into the way the way care is conducted. And I think when you do practice-based research with patient partners or people with lived experience, the data that you're incorporating is data that is patient-oriented and has the patient perspective incorporated into it. So it's, in my mind, some of the most important data that can be incorporated into a learning health system.
So I think, you know, when we think of the learning health system cycle, you know, we have our research challenge and we have our KT challenge, and with both programs combined, I've actually seen, you know, some teams do a research challenge project, you know, once or twice to like generate enough evidence, and now they're looking at our KT challenge program to do the implementation and scaling their findings across their different clinical settings. And this has worked really well with one of our teams who has a regional role. So it gives them kind of the mandate to kind of scale and integrate the findings across all of the care settings. So the two programs combined, I think, kind of feed into that. And I think it's giving the healthcare providers the time and the space to do the work. That seems to be the main challenge. But I think they're there and they're interested in it. But it's tricky to balance it with their clinical duties.
Absolutely. And that's a really important thing to note, that when you have clinical practice to deal with, that research is often a little bit of an extra thing off the side of the desk. How about Christy and Christine? Do you have anything to say about the potentials for learning health systems? Or?
I think honestly, I'm still wrapping my head around that concept. I think it's a complicated concept to fully grasp, but I do see that it's something about helping to really keep the journey and the story going, and to keep it evolving and to keep having those positive impacts and benefits to our healthcare system. And again, the work we're doing is continuing to embed that at every stage of the process and ensuring that what's ultimately being done in our care and our practice is actually going to be the best for those individuals. Christine, do you have anything you want to add to that?
I don't think so. Well, I don't think so as I take the mic. But for me, I think it's more important that research actually asks the questions that patients want answering. And that researchers actually take note of putting their findings into real world and real life case histories. You know, if it's not a practical thing for people to do, then it's not going to be serving any useful purpose. So they have to ground their findings in practicality or in real world implications. They have to ask, how is this going to impact patients? And is this is what when I review practice-based research challenge synopsis, I ask, why is this research question important? What is it going to solve? Who is it going to benefit? And who is ultimately going to benefit from this research question being asked and answered?
Great, thank you. So I think we're going to go to some questions, but before we do, I just wanted to recognize that we do have a couple of people in the audience who are part of the POPRC. We have Kim from BC Children's and Women's Hospital, who's just starting up her own practice-based research challenge. So I don't know, can I ask you a question? Is that allowed? Is that allowed? Okay, good. Ryan, go give her a mic. Kim, so what's it like for you? You are one of the newer members of the POPRC.
So it's a multifaceted thing. First of all, when you're starting one of these and you're starting to build an argument for your foundation that's going to support it, you're always better off if you've got some success stories to bring along the way, some evidence to show how it's going to benefit that health system and that organization. And so certainly through this group, I've been able to provide that and be able to provide a more convincing argument for why this is worth investing in. And that's not only benefited that from the perspective of the funders, but also understanding that we need to get leadership, particularly operational leadership buy-in. Because, you know, when we think about the core functions of healthcare people, it's about patient care, particularly at times when our health system is stressed. But our health system, when it's stressed, also needs to consider, well, how do we recruit and retain high-quality healthcare people? And we, as part of our work and inspired by some of the things that this group had talked about, ran a research culture survey before we started just to get a sense of where we were and a baseline. And it most certainly asked questions about the roles of patients as partners in work and how people saw that, where they saw that there were opportunities, where they felt uncomfortable when they were asking or talking with families about being engaged in research. So we better understood where we were starting. But we also asked the question of our healthcare professionals at a time when we're in a healthcare crisis. So if you were able to engage in practice-based research, would that make you more likely work there? Would that make you more likely stay there? Over 50% of people who responded, and we had a 17% response rate, so we had over 300 healthcare professionals, allied health and nursing point of care respond, said, yes, if I could do that, that would make a difference for me. Understanding that our healthcare, who our healthcare people are, is changing, and this generation wants to be empowered to see opportunities and to change when they're seeing things that don't look right. And some of that's from their engagement with their families and their patients. They're hearing day to day about how the health service may not be working for them, and they may be identifying those gaps. And so this is one of the ways that we can empower that learning health system approach to, we need to start collecting data. I'm seeing this, I'm observing this. How can I start to gather that data to help me make changes, perhaps partner with researchers to do that work, partner with my patients and families who know that experience. On a very personal level, starting from scratch is huge. And so having these mentors, having Christy talk me through what this looks like, having Aggie and Amanda share their learnings along the way, working alongside what does your core curriculum look? How do you go about doing these? What would this look like? It reduces waste in the whole system when you can work collaboratively along the way and learn from each other. And then when you do things like you have practice-based research days like we're having tomorrow, then you still tap them on the shoulder like Aggie Black and you ask them to be part of it. But honestly, all of those pieces along the way, even practicalities like how do we evaluate engagement along the way? Well, we've already got that from the work that's been done by this group to start that along the way and to set the stage. So you've already got a checklist for things you need to make sure you're putting into place so you're more likely to have success. So we are learning as we go from each other and building on from that. So yeah, thanks for asking. I just feel like I've been really blessed to be invited because when I first came in, I must say, well, I'm not doing one yet. I feel like I'm a bit of an imposter, but it really did set the stage for us to have success in moving forward with our first one.
Thanks, Kim. And I'd like to thank Bet, who is in the back as well, who's also involved with the PERC. So thank you for coming. Are there any other questions from the audience? Oh, Kent?
Yeah, most of these panelists know me in various other capacities. And just for those who don't, I'll just briefly explain that although certainly diagnostically I am a patient, my intersecting professional perspectives come from many other directions. Interdisciplinary team-based care, patient-oriented research competencies, et cetera, et cetera. And in listening to your talk about this endeavor, there was a slide there I saw about mentorship, and it reminded me of where I have been a mentor in other settings to clinicians who are wishing to engage in research. And so I wanted to ask any of the panelists who feels capable of offering an answer, where was the balance and how challenging was the challenge of having to orient clinicians to research competencies within context and having to orient researchers to clinical competencies within context?
I guess I would say, tell me if I don't answer this fully. The people who participate in our program, some of them are highly skilled researchers already. Like they may be practicing as a point of care physio, but they already have a master's. Some of them already have PhDs. But it goes all the way from that to a point of care nurse in the OR operating room who's never done a research project. So we provide, with a huge amount of assistance from the UBC School of Nursing, 2 research workshops that try to at least touch on the basics of what is a good research question. But we always start with having the librarians do a literature review workshop, because we want, fundamentally, I figure if people get nothing else from the research challenge, they get knowing where to go to find good research evidence and who their librarian is, who should be your best friend if you work in the healthcare system. Their librarians are just an incredible resource. So we do give them kind of fundamental, what's a good research question? How do you frame it? How do you find the evidence so you know somebody hasn't already asked that question? And then how do you put together a short 5-page proposal that says how you're going to tackle this question? Does that answer what you're asking, Kent?
Yes, I think you partially you did. I'm interested to know if anyone else has anything to offer.
Yeah, I think I would just say we do. We've pivoted a little bit. We do some webinars now for basic content. We follow up with individual consultations, and then we make sure our clinicians are partnered with a good mentor to help guide them. So if our clinician has a strong background, already has a PhD, maybe they're looking for different qualities in their mentor versus someone who may be brand new to research. They need maybe a more experienced researcher to help, navigate those processes. Yeah.
And have you engaged in a reflective evaluation for those, newbie clinicians that are getting involved in research and have benefited from mentorship of various kinds? To better understand what works and doesn't in the engagement for them?
Well, I think, Aggie, you've published on this. So.
I think we've evaluated the research challenge so many different ways. And one of them was mentorship beneficial. So we asked the mentors what benefit they thought participation in the program had on the researchers. And then we asked the researchers, how helpful was your mentor in kind of keeping you going? And people felt overall incredibly positive about having a mentor.
Yay. Speaking as a mentor, I'm thankful for that. Kim, I think you had something to offer maybe in response to my questions. Did you have something to offer?
I think it was just around your professional practice question. Like you added professional practice to it, and I think that's kind of separate from our research in some ways, but it is related. Because when we think about our healthcare people wanting to provide the best care, wanting to reach out for where the evidence is, whether it's Indigenous ways of knowing as an important source of knowledge, or whether it's from our more traditional ways of our researchers and the work that's out there and that more rigorous systematic information that also comes our way through our things that are published and things like that. We really want our people to be using, that's part of their being professional practitioners. That's part of professional practice. And also working collaboratively. I mean, many of them have, there's added benefit when we look at their applications that they're choosing an interdisciplinary approach, that they're thinking from the outset with a partner with those other lenses, how it might work alongside the whole of the team and therefore be more likely to be implemented and sustained. So it's a really good question that you ask about that, but I mean, I'm open to what others have found in that experience. So I mean, the answer to that means that even if that person doesn't choose to go on, and some do, go on and do more research and will get themselves as, for instance, investigators and are affiliated. We have 3 affiliated research institutes. Others will maybe remain in their role, but have more of a leadership and a champion role for having that approach to how we do things. And that added benefit of thinking, having done all that they've done with the PERC or with their partners, to really have that family, patient, lived experience person lens that also comes in, which I think in the learning health system, Linda Lee suggested that perhaps sometimes in quality improvement that might not always be front and center. It can be, and some are very, very good at that, but it certainly emphasizes that. And so then they might work more closely with their patient and family engagement advisor in their unit, or the advisories that are present, or think, well, we need to also include those folks.
One thing I would add in terms of evaluation and the PERC is that we are in the process of evaluating, asking patient-family partners and asking the research team leaders, how was the experience of working together? So we don't have results from that yet, but we've put together a survey that both the PERC helped write the questions and the researchers, or we as coordinators, helped write the questions. So that, we hope, is going to tell us what's the experience like for you working with a patient partner, and for the patient partner, has it been good for you being on this team?
Yeah, a two-part question. First, I mean, you talked research in a sort of a general term, but all knowledge translation's also part of what you support, right?
Yes, yeah.
Both of you, in both of your sites? Yeah. Okay. So there's, for some of us who are patient partners, but not through PERC, for example, we're involved with initiatives, and there is one, I'll talk with Aggie after about it, where we are taking knowledge externally, generating new knowledge, potentially a learning system. Are you interested in us kind of feeding back through your setup that this is actually happening, so you know what's happening outside your more immediate work that you're doing, just to see, just to build a bigger profile of what's happening, and maybe even bring some of these initiatives under, with your support? So it's that kind of question.
I think we're always open to learning about other projects that are going on, and if there's potential opportunity to collaborate and how it fits with our programs. Yeah. Oh yeah. Oh yeah. Absolutely. Yeah, for sure.
BC Mental Health and Substance Use Services are provincial organizations. So it is a good question, and that might be something that we would look into.
I thought there was a question over there.
Was there a question over there? Sorry, did I miss someone? Oh, sorry. Oh, you need it for the online.
Is the PERC involved in setting priorities for research areas or research programs, and if so, how?
Use the mic.
Oh, here.
Use the mic if you want to.
Oh, Ryan got to her fast.
Yes, you're making my brain hurt trying to think about that. I think specific research priorities are quite varied depending upon the department, the program itself. I think we have a really solid collaborative relationship, a trusting relationship where we're really open with the various organizations, Aggie and Amanda, and they do come to us, and they do look to us for guidance. They do look to us for what we want to see. So I do think, in essence, we are setting those priorities. I don't know if it has been formalized per se, but I think they're now, rather than just forging ahead, they're coming to us as those individuals that lived experience of the research, of our healthcare, and they're asking us, what do we want to see? Where do we want to see these programs go? So I would say that. I don't know what they would think as well.
I would say yes at an organizational level, helping guide us where we're putting our funding and our resources. Yeah.
I think just the work with the PERC has made everybody at Providence who's associated with the Research Challenge or aware of it more aware of the importance of including the voices of people with lived experience. So people, I think now when they think about the Research Challenge, they know that that's one of the components, and they know we're going to support them to do that. So it's not something we mandate and then just make them go out and do it themselves. We let them know there is a group like the PERC, and there is a a lead for person family centered care at Providence who helps people identify patient partners to collaborate with them. So I think the more that collaboration becomes second nature, the more the priorities set by patients become part of the way we do things. So I would love to go even further upstream and have patients say, this is what we think you guys should research, and then try to match make with researchers who are interested in those topic areas. But we haven't quite gotten to that step yet.
Patient-initiated research.
Sorry, yeah, I think when I looked at the practice-based research challenges from last year, I actually went through them, and some of them already had patient and family partners on their committees. So right from the beginning, they were going right out of the gate and having patient partners on their committee, which is excellent. So we've gone from having no patient voice to people actually thinking about bringing in the patient voice. So that's, to me, it's like sticks and stones to fire. I've got fire.
So we've run out of time. Any last comment, Christy, before we sign off?
Not really.
I think we've run out of time, Beth. You can come up and ask and talk to us afterwards. Thank you, everybody.
Just ensure you do pour.
Thank you all for coming today. Sorry, Christy. But yeah, if anyone has any questions, they want to come and chat.